Hi, I'm Dr. Jim Turn, a chiropractor here in Somerville, right on Trolley Road. Today I'm going to talk about X-rays. Why X-rays? The quick answer to that is because we need to know and not to guess. So what is it we need to know? Well, first, when we look at an X-ray, we need to rule out possible things like tumors and infections and fractures. Now, I've been doing this 30 years and I can count on one hand how many times I've seen these type of things and had to refer them out to the proper specialist. But I have seen them. So it's important that we look at that and rule that out. But what I'm looking for is things such as anatomy and posture and alignment. One of the things in alignment that's very important are the curves in the spine and curvatures. Now those are two different things. Curves, we look at from the side, you can see how the spine is curved. And that serves like a spring. The arch is one of the most stable forms known to man. And that curves are important, they're a good thing. From the side is curvatures. We see things such as scoliosis. And so curves good, curvatures not so much. Okay, so how do we look for those curves and curvatures? Well, X-ray. Come on around here, this is an X-ray of a person facing this way. The red line here shows the back end of the bones here of this person. The green line shows optimal curve in the spine. So it shows me, A, that the curve is gone, and B, that the head itself is carried forward about 2 inches. And what that translates to is that's like carrying an extra 20 pounds around your head. No wonder your neck and shoulders are hurting. The other thing we see here is we look at these little dark areas. Those are disc spaces. This one you can see is a little smaller and a little more irregular than, say, this one. So that tells me this area right here is under stress. We can see there's a slight bending back of the curve at that point. So that tells me where to adjust, where the areas of stress are, and the degeneration can tell me how long it might take to get this fixed. The other thing we look for is something called compensations. Someone might come in with neck pain, and I'll look at their X-ray, and it looks pretty good. And then we take a lumbar X-ray and we see that the pelvis is all offline, misaligned, or there might be a short leg. And that might be the cause of the neck pain. The analogy I like to give patients is it's like a house. The foundation is not correct, the roof will be off and might leak. Now the symptom would be, my roof is leaking, I gotta fix it. And every time I patch it, it starts leaking again. But the problem is the foundation needs to be corrected before the leak correction will take place. So understand, X-ray is not without risk. But with our modern technology, the radiation is minimal, and we find that the risk-reward is well worth it. So just in review, why? We want to know instead of guess. We want to rule out things such as tumors, and we're looking for proper alignment, posture, and anatomy, such as the curves in the spine. Well, that's it for today, and we'll talk to you next time.